When my grandparents first started working with doing research and they were educating doctors, they were actually doing blood tests in the 90s. They would educate the doctors on what was going on with people's phospholipid levels, essential fatty acid status. And they were using IV, the doctors, the MDs and the DOs were using the IV drugs. So phosphatidylcholine is a drug that is manufactured, as is sodium phenylbutyrate, glutathione in a drug form. They were using them as IV drips. And my grandfather looked at it and said, there is a way to come up with an oral version of this. And so he developed the oral because it's so much more accessible. But in developing the oral, he worked for 2 to 3 years, specifically with our formulator, who's still with the business and who's still manufacturing. He's actually in our butyrate facility today. So they worked together to figure out how can we isolate the various different phospholipids, extract them, protect them, and package this in a liposomal form. So you need, in order to make a liposome, you need phospholipids, right? You can't have a liposome out of MCT or anything like that. So firstly, when you're looking at liposomal supplements, approach with a weary eye. That is something that I always recommend to
Mm.
people. As you know, as somebody who works in the supplement industry and who has your own line of supplements, there are hundreds, if not thousands, of supplement manufacturers now. And what you're looking for when you partner with a co manufacturer is one that you trust, that is making things of integrity, that is looking at the raw material sources, that is not cutting corners, that is certified in all the ways that you want them to be certified so that their machines are going through strict quality control and quality assurance measures. For us, that's both us. So we both manufacture and we market, which makes us very unique in the supplement space. I would say there's probably a handful of companies like us.
Mhm.
Most are very large conglomerates that are making supplements. And so we get to see from start to finish every single thing that goes into our products. And that's why it's not going to be the cheapest on the market. You can get phospholipids from taking soy lecithin. The problem is that they're going to break down in digestion into choline and triglycerides. It's not actually going to supply the cells with phospholipids. They're just going to get broken down. And so my grandfather figured out a way to isolate those phospholipids so that when we take them, they're in a liposomal form. They're going to make it through the gastrointestinal wall for cellular delivery through the bloodstream. And that's where it differed. So if you go on Amazon and you Google and you see Thorne Designs for Health, Doublewood, PC, it's lecithin packed in oil. It's not
And
going to do anything.
those are reputable companies,
They
right, that you just mentioned.
they are.
We're not even talking about the other ones, and just a couple stories on the quality of what you're talking about, the quality of supplements. We were manufacturing one of our supplements that have some mushrooms in it, and the stringent levels that were applied a couple years ago to allow mold and bacteria in had grown because of COVID, because of costs, because of inflation. And a lot of companies are allowing more mold, more bacteria in
Yeah.
their supplements. So we had to go searching for a new source for those specific ingredients. And I actually just got a text from my manufacturer this morning. We're coming out with an amazing liver pill, accelerated liver care, and he said, I have to find a new source for this ingredient because I looked at the flow chart. No one looks at the flow chart.
Yeah.
And that's where is the organic, amazing ingredient going in its process to get into that pill?
Yep.
And there was a toxic element to it that was causing toxicity for that ingredient.
Yep.
No one looks at this stuff.
No, and you know
It's
what? They slap a label on it, they call it organic, they put it on Amazon, and people purchase it.
right.
And it's crazy. This is the same thing happening with liposomal supplements. Anyone can say that their product's liposomal. Do you know what they're mixing it with? Soy lecithin. Because every other manufacturer, there's a handful of manufacturers that are doing it well. Live on Labs, they create liposomes. I like their liposomes. Quicksilver, different form of liposomes than ours, but are creating liposomes. The other companies, there's another company called Phoscol. They're creating liposomes. That's it.
Yeah.
Like, I'm not going to call out the other companies,
Right.
but that liposomal supplement that you're buying from everyone is not liposomal.
Right. It's really important because you could be taking something that is backfiring, making your symptoms worse, or creating another issue.
Or a
Um,
waste.
right.
Glutathione, you need it to be liposomal for it to work. So why waste your money on expensive GSH that's not even going to be utilized in the body?